All right, guys, so here's the last one, probably the most, maybe overwhelming of all of them. We got the maxillary artery. It's broken up into 3 parts. We have 3 little mnemonics to help us remember them. So the one that I use is dam, im. You can use dam and I and just leave out the M-I-M. Totally up to you. But this is the first part, the mandibular part. So we have, they're paired up. So TMJ and TMJ, pretty easy. Deep auricular and anterior tympanic. The only difference is that auricular has this external auditory meatus involved, which is part of the ear. Tympanic has that tympanic membrane, right? Makes sense. So TMJ together. Then we have middle meningeal, and that's the meninges. And then we have the accessory meningeal, which is the meninges, which is pretty straightforward. Right here in this middle meningeal, we'll talk about later, it has epidural hematomas. Okay, so now I have this inferior alveolar. This is for the mandibular teeth. This is that runs through that incisive canal. So we have the nerve obviously with it as well. But mandibular teeth, the buccal gingiva associated with it, and it travels with that IA nerve. So inferior alveolar breaks into these 3. So that's why I like to keep the MIM with it, but you don't have to. Mylohyoid, would you imagine that it would go with the mylohyoid muscle? Incisive, right, that incisive canal exits near those anterior mandibular teeth. And then the mental, think about if you're thinking and you put your fingers on the edge of your chin, you're mentally thinking, right? So that's the chin, it's that labial gingiva. Like I mentioned, the middle meningeals, they go through the spinosum, and if you get hit hard enough in like your temple area, you can have an epidural hematoma and die. So that sucks. So that's a dam, im. Okay, this one, super easy, part 2. All it is the muscles of mastication. So if you think of a muscle, just has that associating artery with it. So deep temporalis, and it goes to temporalis. We have the pterygoid branches. It's medial and lateral. You could imagine that it'd be the pterygoid muscles. Masseteric, which is the masseter, right? And then the TMJ. So we've already done all 4 of our muscle mastication. Then we have our extra one, the bustinator, which is just from the buccal artery. So I just call this one muscles. Other people have names for it, but I don't figure to have a name for it. It's kind of too easy. So the last one is PI pads. And we'll go through it. So this is probably the hardest one. The pterygopalatine, which is the 3rd part. So it has the PSA, and if you look here, it has that ASA, right? So these 2 kind of match up. PSA is the maxillary molars and the gingiva and the maxillary sinus. The infraorbital has the ASA, and it's the maxillary canines to the incisors, and I would assume it's part of that maxillary sinus. The pharyngeal would be the pharynx, and the arteries of the pterygoid canal would be the pharynx. So we have these teeth ones, and then we have the pharynx ones. Now we have this descending palatine. This guy breaks up into 2. We have the greater palatine and the lesser palatine, and we've talked about these a lot. We have the hard palate and soft palate, and that's how we would anesthetize those areas. We have the sphenopalatine, also called the nasopalatine. That's the injection that really hurts. It's through the incisive foramen, and it goes to the postlateral nasal branches, the postseptal branches, so it goes to our nasal septum. And this is the one where if we have epitaxis and our nose bleeds, this is the guy. So epitaxis is when you pick your nose too much, or it's often associated with picking your nose. And the common artery is that sphenopalatine. So that's PI pads. So we have dam and I, or you can do dam and imim. We have our muscles of mastication. Then we have PI pads. That's the maxillary artery.